global pandemic experience has very quickly pushed us into greater use of precision public health, to the point where I believe that the general public is going to expect greater precision and greater performance, even if they can't actually name the concept of precision public health. Now, one of the next areas that got a lot more precise was contact tracing. Now, as you know, contact tracing is a process that health departments perform to help break transmission chains before an infected person has a chance to spread that infection to other people. And I actually became a certified contact tracer so that I could make sure that I really fully understood this process. Well, what we were able to do was apply GIS to help health departments collect and manage their contact tracing data, do rigorous analytics, and evaluate their processes. Now, what you're seeing here is a sample of a typical contact tracing form. And I kind of blew up that exposure information section. It's the only part that has location data in it. But the level of location data that they're collecting just isn't very useful. Like, have you traveled domestically? And if you say yes, what state did you go to? That's not going to help us make decisions or understand community spread. So we developed apps to make gathering all of the survey data much easier, as well as fine-scale location information. So I think this is about much more about identifying locations that somebody visited during the interview process. This is not, by the way, about tracking people, just to make that distinction. Now, when you have that location data, you can start to do things like link analysis. And with link analysis, you're going to develop better understanding of the person-to-person connections that, of course, are that traditional focus of contact tracing. But there's an and here. We can also use tools from graph theory to help us determine the strength of person-to-place connections that are really the focus and deeply important for community spread of disease, which of course is the case with COVID-19. And I would say that evaluation of the contact tracing process is critical, because in this case, speed is of the essence. Map-based dashboards can help with identifying and mitigating bottlenecks in the system, which could slow it down and therefore impact its overall effectiveness. Now, a key part of contact tracing and that process is the availability of testing. So we've all heard testing and tracing, right? They go hand in hand. Well, using geography to be super precise about selecting locations for new testing sites was a very common use case that we saw. And in fact, it paved the way for the future site selection needs, like finding vaccination venues with a focus on equity. So here's how that site selection model works. You start with population demand. In health, we're more likely to say the population need for the service you're about to provide. And that could be any combination of factors or phases or risks or vulnerabilities that you want to include. Then you can add candidate sites, then accessibility requirements, like there must be accessibility in a 15-minute walk time or a 30-minute drive time. Then you input your operational information, like having a budget for 10 new sites or enough staff to support 5 new sites. So the model takes all of that information, crunches the numbers, and selects the most optimal of the sites possible. And actually, that's just the beginning of what can be done to support site selection for testing locations, and now especially for equitable vaccine distribution sites. So for example, GIS can still help us to determine more precise accessibility calculations, even in places without a lot of roads or road network data. So in this example that comes from Uganda, we've used data sets like elevation, slope, and land cover to calculate the difficulty and thus the time it would take to traverse various kinds of landscapes. Now, public communication during the pandemic has been a really important area, and it turns out that ArcGIS Hub is a really good tool for this because it's quick to configure and it can contain information and interactive maps and apps that update people about how, when, and where they can get their vaccine, just for example. So we created eligibility apps, vaccine locator apps, and community progress dashboards. And of course, easily accessible and accurate information sharing builds trust, and that's just one part of curbing vaccine hesitancy. So speaking of vaccine hesitancy, we can use geographic information to help build vaccine confidence. So in this example, we pulled study results from Pew Research to identify characteristics associated with vaccine hesitancy and mapped areas of higher risk. So from there, GIS can be used to connect with local community partners for outreach and even provide them with local level infographics to support what I would call strategic communications from those community partners. And I think this is a really good example of data driving action. And further, we can use data to identify the areas where people fail to turn up for their second vaccine dose when you're taking Pfizer or Moderna, for example. And this could happen for any number of reasons. Maybe there was a mobile or pop-up clinic that was moved before everybody was able to receive a second dose. Well, GIS can help identify these areas and even actually leverage demographic data in quite a different way to create more resonant messages that will appeal to the locals and deliver them through the most relevant channels and in the right languages. So using GIS to support vaccine distribution can also extend to solutions like site planning and crowd management at vaccine venues. We have tools that can help track the supply chain to minimize the impact of any disruptions that could occur. And even applications like a COVID-19 screening questionnaire for employees or visitors who might come to your buildings, and things that would support what is being called the future of work. We've also configured an inventory management system for vaccines and the vaccine supply kits that's really quick and easy to use because it can read the vaccine barcodes from your smartphone. So what do you do to make progress and be more ready for the next pandemic? Is invest in configurable technology so that you have the flexibility to make changes and modifications as crises evolve. Keep your workforce trained on the technologies that you own so that they can perform that analysis and create information products quickly when the crisis arises, and focus on connecting your technologies. In other words, interoperability is so important so that you can pull data from your current data feeds and ensure that you get real-time or near real-time insights. So the pandemic and all of its consequences and ramifications has been and continues to be difficult, no doubt about it. But we've learned a lot. We've seen incredible innovation and we've shown new ways to get things done. So as the pandemic eventually winds down, I think we can't lose momentum. We can't rely on muscle memory and the way that it's always been done before. I just say that's not acceptable. We need to harness the funding and the public demand in our year of lessons learned and technological advances to leapfrog to the next level.